now going to move into our final session for today, our roundtable discussion. We've assembled a group of healthcare security professionals from across Canada and the US to talk about some of the most pressing challenges across the healthcare security industry this year. So I'm very glad to be rejoined by Martin Green, who is the Manager of Security, Telecommunications and Emergency Preparedness at Baycrest. Also, Haji Sar, who's the System Director of Public Safety at Houston Methodist. Paul Sarnice, Assistant Vice President, Safety, Security, and Emergency Management of Virtua Health. Jeff Young, National Director of Healthcare at Garda World. And Faiz Bilal, who's the Security Manager, Security Services, Women's College Hospital at Black & McDonald Limited. Oh, he's got the hat on. Good job, Paul. Okay, thank you, gentlemen, for joining me today. We'll just get right into it. Actually, before we start, I just want to say to our audience members attending, we'll try and leave some time at the end for Q&A from the attendees. So if you have a question for any of our panelists, you can record it at any time, and we'll try and save 5 or 10 minutes at the end to address those. Okay, so first question for our panel today. How has the second year of the pandemic compared to the first, and what lessons did you carry through from 2020? Who wants to get us started here? Martin, you're unmuted, so you're up first. What do you think?
I don't know. The second year just seems like the first year. It's just been a never-ending cycle of, I should do this for Paul, sorry. It's just been a never-ending cycle, and we've seen a few changes, but it's, I said, it's March of 2020, 2019. It really hasn't changed other than just, a few nuances.
Thanks, Martin. Faiz, let's go to you. How has your experience compared 21 to 20, just in terms of what you've learned and how it's stacked up for you?
See, I would say personally, I feel like this year has been a lot busier than the last. Like between our standard operating procedures, just the assessment center, the mobile vaccination clinics, then the Directive 6, plus we have a lot more traffic now with clinics, right? Including mental health cases and just on the rise, and also sexual assault and domestic. It's been overall very, very busy, but we're making sure that a lot of the stuff that we learned from 2020, especially in terms of processes and organizational just structure, that kind of helped us out in terms of organizing this year a little bit better. So that kind of worked out for our benefit. But overall, I do feel this year has been a lot busier.
Thanks, Faiz. Haji, how is what's your experience been comparing this year to last?
And well, first of all, thanks for having me. It's a pleasure to be here. What my colleagues just said, and I would add to that the fact that, during the first year of COVID, what we were focused on at the time was vaccine security. We were trying to figure out how do we secure the vaccine. I mean, it was new. We were trying to obtain and develop logistics around the transport, the safety of the vaccine, and risk, and then also we'll focus on possibility of folks trying to just sabotage the vaccine. Then also we'll focus on what you call locking down the hospital. So the first year was pretty easy in the lockdown piece because you didn't have to deal with too much visitation. So we locked down the facility and that's it. The second year after that, obviously we're talking about now the political aspect of the vaccine, because now we're talking about the mandates, right? So we had to focus really on vaccine mandates. We had to focus on, the political challenges, the visitation management piece of it. We had the governors of the state, the law changes. Okay, now 2 visitors, 1 visitor. We had to learn to adapt. That is my take on the difference in the 2 years.
Thanks, Haji. Paul, let's go to you next.
Yeah, I mean, I agree with everything that was said. I mean, we're kind of in our third wave right now, so we're kind of back to somewhat of a pre-COVID normal. So, our operating rooms are booked. We have visitors that are allowed to come in, although it's limited. The supply chain issues are just different. I mean, where we had shortages of N95s and gloves and some of the medications to treat ventilated patients, that supply is available. Right now we're seeing, aluminum being in shortage, and we can't get crutches and walkers and wheelchairs can't be produced. It's supply chain issues, but just in a different realm. I mean, our numbers are about a third of what they were at our peak waves, but it feels like we're busier. It just feels like it's nonstop, and it just feels a lot busier. And I think people are at that point where we don't see the light at the end of the tunnel, some of us, and it's we're 21 months into this now, and I think the anxiety levels are different. We didn't know what we were facing before, and we didn't know if it was airborne or contact. Now the anxiety is, when the hell is this thing going to end, and when can we get back to normal, and are we going to continue to work at this pace? The pace that we're working at today is totally different than what it was 2 years ago, and I don't see the light at the end of the tunnel, unfortunately. With it right now, and because we have to vaccinate the world. You look at Africa, 2 to 3% vaccinated, and other parts of the world are not vaccinated, and people continue to travel. It's just, I think the reality that we're in right now with Omicron, which just was announced. I mean, that there's going to continue to be mutations and different variants that we're just going to have to deal with. So I think, unfortunately, I think we're kind of stuck in this for quite some time. It's just different. It's different than the first wave. It's different than the second wave, but it's just as stressful and anxiety producing. And so.
Thanks, Paul. Before we move on, Jeff, from your perspective, a frontline perspective, service provider, how has it been for you?
Yeah, thanks, Paul. I think as far as lessons learned, and I'm not sure it's a lesson, but just something that I knew, but just how resilient our staff have been, that's staff across the board, and how we stretch those people and challenge their skill set. And I think, those folks really did meet the challenge, and I'm hoping out of this, those frontline healthcare security officers get the recognition that I think that they deserve, because they've done a bang up job. And this isn't a Garter World thing. This is across the board. Our healthcare security officers, our frontline staff have done a tremendous job during this, global pandemic. And I'm hopeful that the recognition will now come along that they are truly part of that care team and such a critical part to the healthcare organizations.
Thanks, Jeff. Okay, next question. With vaccines available, we've seen some protest activity. This was something that Jerry mentioned, and the challenges that come along with that. Haji, I'm going to go to you first, I think, for this one. Can you just describe your experience dealing with those challenges and how you've met them?
Where do I start? So I'll say that, we've been dealing with protest activities since March of 2021. So our healthcare system decided to take a position since March 3rd. That's when the announcement was made. So very early in 2021. So with that being said, with the Houston Methodist being the first hospital to implement that, and the deadline was June 7, we did have a lot of national exposure with the media. I mean, they were all here. So that was the only talk of the town at the time. So we had to really, refocus our effort at the time, because we were just getting all inundated with all kind of threats, phones, angry people across the nation, internationally. So we had to do some mitigation in that sense. So we have to refocus our effort in one, threat management surrounding the anti-vax, but also we have to deal with refocus our effort, our security operations in civil disturbances. So, at first, in the very beginning, we did receive some challenges with local anti-vax protests, like small, about 5, 6 maybe all the time. But then after the vaccine mandate, with those folks, the coverage, we had to, deal with the bigger national anti-vax movement, with threats being both at the internal level, all those employees deciding to walk out, and then threats being dealt with externally. So yes, a lot of challenging. That's how we dealt with it at the time, and still now, actually.
Thanks, Haji. Maybe Paul, do you want to talk about some of the challenges, even from a sort of broader perspective,
Yeah, absolutely. I mean, my organization who I work for, Virtual Health, we operate at one of the mega sites, and a mega site was designed to do about 6,000 vaccines per day. And when we first opened up, yeah, we had the anti-vaxxers out there at the entrance and at the exit. We had to get some restraining orders, deal with the civil police, and kind of limit their locations and limit their numbers. Never disrupted the operation of the vaccination clinic, but it was just something we had to deal with. The majority of the confrontations or the aggression that we saw was early on in the vaccination process, is when we had, it was 65 and only high risk individuals. And we would have individuals that would drive 3 or 4 hours out of from New York State to New Jersey to get the vaccine. And here we're giving them very bad news. I'm sorry, you're not from the state of New Jersey. You're not authorized to receive the vaccine. And that really put our staff at risk at times with very irate individuals. As the mandates changed and it became more open and more accessible, we saw less of that aggression. But the anti-vaxxers are going to be here forever. People have their opinion. It's just something that we're going to have to deal with. And the organizations that made vaccines mandatory for their staff, we all lost employees. We probably lost a good percent. It's maybe a small percentage, maybe 5 or 6% of our employees or more in some organizations. But we put those mandates in to protect our patients and our employees. And unfortunately, or fortunately, however you look at it, people have the right to make that decision. So, I think as boosters become required, right now we're considering a second dose being fully vaccinated. That could change in 6 months. And we may say, you need a third dose to be considered fully vaccinated. Well, we may have a different wave of protest and a different wave of kind of resentment and some aggression from our colleagues, from our employees, if that becomes the reality. I just think it's something that we're going to be dealing with for quite some time.
Thanks, Paul. Jeff, maybe can you talk about it just from the frontline perspective of dealing with potential for unrest outside of healthcare facilities?
Yeah, thanks, Paul. I think two things, or Neil, I think two things. One, Paul reminded me of, that we should have, a threat management program in place. So we've got individuals, known individuals or groups that are well known, and have a threat management program, have that close contact with law enforcement to get that intelligence, to know, where these groups are going to show up, where they're targeting, et cetera, because a lot of that can be found in an open source investigation standpoint. And just another thing too, we live in a democratic society, so we have to, support people's right to protest. I'm thinking of a Vancouver incident where I guess a bit backfired, the messaging from the anti-vaxxer group, where, they decided to protest at a hospital, and they had 5,000 folks show up at Vancouver General Hospital that ended up impeding ambulance traffic into the facility, and the media backlash and the public backlash that the group got from that really backfired on them. So I think that they had to rethink that, and of course now we have laws being put in place that prohibit that type of protesting outside of hospitals.
Thanks, Jeff. Maybe if we can hear from Faiz or Martin about what's going on in the GTA or what you've heard about.
Martin, I'll let you go first.
Okay, so as was alluded to earlier, the social media was the driving factor, and people were saying on such and such a day, we are going to meet at this hospital and protest. And in Toronto, that was the downtown core, University Avenue, which is referred to as Hospital Row. So I personally wasn't worried because, first off, I'm a non-acute care hospital and I'm not on Hospital Row. But again, the intelligence gathering, and I did reach out to the local police department and my division, and they said, no, we're pretty sure it's all going to be downtown. But and it was, I don't think it was too extreme. There were a few people that decided that they had an important position to be heard. But the thing is that it's demoralizing for the staff that are working. When you're working as hard as you are to protect people, to save lives, to heal people, and you have a bunch of people standing out on the sidewalk in front of where you work, telling you that you're a horrible person and that this is terrible, it's demoralizing for the staff. I don't think that the protests that took place in Toronto were very successful. They didn't make it into the hospital. And the news media and the news representation was that they were, they were more of a nuisance than having any impact in reality.
Thanks, Martin. Okay, so this is another topic that's been raised a number of times during today's session, but have you experienced any escalation in workplace violence or increased tension in your facilities as a result of what we've all been going through in the last almost 2 years now? Paul, do you want to go first on that one?
Sure, thanks, Neil. Yeah, my organization had 193% increase in the number of employees that were injured by combative patients. And, we can talk about, the anxiety and the stress and the restrictions that were put in at COVID. Our hospitals are a microcosm of society, right? And I think, speaking about the US, and because I can't speak for anybody else, but in the US, it seems like violence is becoming a more acceptable response for inpatients and entitlement and so forth. And that's spilled over, unfortunately, it's spilled over into our hospitals. We've been working with the prosecutors and the attorney generals, and our message has been pretty clear. We were praised as heroes in the beginning of COVID. There's parades that were being done at our facilities. There was everybody, accolades coming out all over the place about the heroes in healthcare. But now we're being the victims of violence. We're 20 times more likely to be the victim of an aggravated assault than any other industry. And we need to, it's a multi-pronged approach, right? Training, worksite assessments, threat assessment teams. There's multiple layers of steps that have to be put into place to have a successful violence prevention program. But we also need the laws to protect us too. And in the United States, we can have one state that has a law that says if you're a licensed healthcare provider, it's a higher degree of it's automatically an aggravated assault. But if you're a security officer or a housekeeper or a lab technician not licensed, it's a simple assault. So we're trying to change the laws. We're also, if you ever have a chance, Google Australian PSAs on violence in healthcare and see the commercials that they actually have on public TV about the problem of violence in healthcare. We're trying to prevent getting to that point. So it certainly has, I think anecdotally we'll say it's increased. The data will also demonstrate that it's increased. Once everybody goes back and you look at your 19 to 20 data, if you haven't already, you're most likely going to see the similar increase that many facilities have experienced.
Thank you, Paul. Faiz, do you have any, what are your thoughts on the challenges that are occurring in terms of violence and de-escalation issues?
Yeah, based on the stats that we have a straight up upward trend of code bites and verbal abuse, even with the safety plans in general, the amount of meetings that we're having. So the facility that I work at, we are a least restraint facility. So that means we don't have restraints on site. Clinical staffs don't apply any chemical restraints either. So the approach that we had for code whites 2 years ago is very different than what we have now. So we had to ensure that all of a sudden, like, NBCI is always there. We always ensure that there's refreshers, but we started working with every single department to start conducting simulation training and code white drills, which was something that we generally just did with either mental health or sexual assault. But not just that, we actually started working with risk management and very closely updating the technology that we had just to be able to provide better range in code white systems and just panoramic cameras in general. So we have incidences being recorded if in case something were to occur. And we used to deal with protests time to time, just with the nature of our facility. But with the pandemic, any time we would end up having a rally right across College Park, they would march down Bay Street and they would pass our assessment center, they would pass our vaccination clinic on the other side, and then you would have individuals just heckling families that are waiting to be tested. So we had to ensure that we were following social medias very closely, and our team, the security team and our contract providers from Paladin actually knew how to deal with a large demonstration, right? Without restraints, you can't just go around arresting everybody on private property. You can't do that, right? So you had to work with Toronto Police, and you had to work with all the hospital all around us so we would know what the right updates were. it's an unfortunate trend that we're noticing. You can only do so much simulation training and anything on the back end. But Paul's right. I need to check out those Australian PSAs.
Thanks, Faiz. Jeff, any sort of thoughts on de-escalation techniques and training and some of the challenges that frontline security officers are facing in the healthcare environment these days?
Yeah, thanks, Neil. I can only echo what my colleagues have said. You know, I think across the board, it's just been an increase, and I think it's challenging for our frontline folks. We need to, you know, maintain our composure because, as we know, everyone has a phone in their hands now, and you know, one incident where we don't respond or act accordingly will be on the front pages. You know, the 100 other incidents is where we de-escalated and did a great job and took a lot of crap, so to speak. Those go unmentioned, but the one incident where we don't respond accordingly is just does ourselves in. So we just need to maintain our professionalism and ensure all of our folks are trained in whatever your de-escalation program is, but ensure the folks are trained in those de-escalation techniques and support them too, because again, we talked a little bit before. I think Jerry had mentioned it about, you know, debriefing with your folks, stress management, etc. It could be accumulative in nature as well. So we need to support our frontline staff, ensuring their well-being as well, because that's a key.
Thanks, Jeff. Before we move on to another topic, maybe Haji, do you have any thoughts on dealing with or managing de-escalation and the possibility of escalated violence in healthcare?
You know, to the question, if we have experience in escalation in workplace violence, I would say yes to what all my colleagues mentioned. I would specifically just want to stress on the increase in workplace violence in regards to disturbances and specific to visitors. We've seen a high level of disregard or just challenges from just mask enforcement. Wear your mask. I don't have to wear my mask. Our officers have to deal with that a lot. Also, you know, because we have to restrict the visitation sometimes to one. I mean, we've seen a lot of visitors challenging that visitation policy, but also visitors wanting to require some certain treatment for their patients, for their family members that we do not necessarily want to provide, or the doctor, the physician may disagree with. So we've seen an escalation on that part when it comes to workplace violence. So we have to thank our officers in healthcare in general. They are training de-escalation techniques. They are training nonviolent crisis intervention. So those trainings are in place, but we have to re-educate and reinforce on what the law says, how to challenge, how to react to those challenges regarding the law in mask enforcement. So just wanted to throw that.
Thank you, Haji. Okay, another issue that's been brought up a couple of times is scheduling frontline personnel and facing workplace shortages. Kind of a double whammy in terms of security and healthcare, but how are you folks dealing with this, and what are the challenges in making sure that your hospitals and healthcare facilities are fully staffed and you know, retaining those folks and making sure that they're comfortable in their environment? Faiz, do you want to go first on that one? Faiz, you're still muted. Oh, there you go.
There you go. So when the pandemic first started, what we did was we have an internal security program. So with Black and Mac, we sat down and we really assessed if it'll be the right idea to start increasing the amount of security staff members we have for our casual pool. So we went ahead and we hired up to 4 new casuals that were kind of working on a full-time basis, and that helped us a lot when it came down to gaps, especially in this year. They're working on a full-time basis, so we barely have any scheduling gap. I think we had like 4 in the last 2 years. But that being said, when we look at on the Paladin contracted side, with any of the additional support that we're providing, you can feel it. It's been a little challenging. I've spoken with Paladin multiple times. They've been fantastic when it comes down to filling out open coverages. But with the school now starting and with the amount of mobile clinics populating once again, it's been rather tough. But they've been great allies throughout the pandemic, and this year I definitely felt the labor shortage.
Thanks, Faiz. Martin?
Yeah, I echo what Fi said, and I also use Paladin as my service provider. And there were some challenges. I did lose some people because some of the people that worked for me at Baycrest for Paladin also worked for Fi's in his in-house program. So I lost a few people to him. So my normal staffing complement is relatively low considering the size of my facility, but the nature of it doesn't require me to have that many people. So my normal staffing complement is 2 people 24 hours a day. Well, with COVID, I had as many as 26 security guards on duty at a time. So, we did upstaff, and fortunately Paladin was able to provide me additional guards that they didn't need at other sites because they service more than healthcare. They service commercial and retail properties. So where a commercial property would normally have 10 guards, they now only needed 2. So we took them from there and we used them there. So we did face a few challenges where we did have book offs, but because I had upstaffed so much, the book offs didn't hurt that much. We were scrambling a little bit, but we weren't left dead in the water. But what I've noticed more than anything, although I've been able to maintain my staffing levels, the turnover has been astronomical. Where I would normally have a security guard on, working for me for a year and a half, I've had them come in and work one weekend and say, no, I don't want any part of this, and they've left. So turnover has been very, very difficult. But we've been able to manage, and it hasn't been easy, but we've made it through to the end so far.
Thank you, Martin. Jeff, maybe you can talk a bit about what it's like from the other side of the coin, staffing up hospital facilities and making sure folks are available.
Yeah, it's a challenge. I'm not going to say it's not. It's a challenge for everyone, and I think, as Martin alluded to, certain markets, we were able to, had a decrease in staffing. We were able to shuffle or move staff over to, the healthcare vertical. The other thing I think we've seen across the country is a lot of healthcare organizations, especially large ones that might have a single security provider, have reached out to have secondary providers to pick up some of that slack. And I think that's a good thing for our industry to show, some cooperation there, really to meet the needs of the client and to meet the needs of the healthcare organization to, again, support that safe and secure environment of care. So I think as a contract community, we've come together and worked, for the most part, pretty closely together and supported each other in supporting the healthcare vertical. And I think that's a challenge. Of course, the other challenges I think we've seen is, when COVID first started, we saw some government incentives or top-up pay, if you will. A lot of those have gone away now. The government, CERB programs, there's a certain amount of folks that would rather sit at home and collect their CERB checks and not work. And I think that impacted us, and I think impacted the general workforce as well. So lots of challenges. And I have lots of sayings. If it was easy, anybody could do it. And this definitely isn't easy right now in our business.
Thanks, Jeff. Maybe we'll go Haji and then Paul on this topic before we move on to the next question.
Sure. I want to circle down to what Jeff you just mentioned regarding the hybrid version. And obviously, there's a lot of things we realize on the other side that, yes, utilizing for big system, utilizing one contract security is not going to work, especially right now. So we had to realize that and wanted to add more than just one. But to specific to the question, I think, I've been doing healthcare for over 20 years now, or close to that, but I've never seen a staff members, career security professional come to me and say, you know what, I can't do it no more. I'm mentally and emotionally drained. I have not seen that before. So I've experienced that. And those are kind of situations that there's nothing you can say to that, because it's real. It is something that's happening. So We can't do nothing about that, but offer support as much as we can. So we've seen a lot of, also when it comes to the application, people applying for jobs. A lot of people apply for, nobody shows up for interviews. You got a lot of drops off, and then also realizing that the quality of the pool that we used to have to hire people is no longer there. Very few, even if you have about 50 applicants, probably one or two would be the only ones qualified. So it's a challenging time. So contract security hybrid version is a good way to mitigate the problems for now, until we can restore the labor shortage.
Thank you, Haji. Paul?
Yeah, I mean, the labor pool is pretty shallow for all of us. We're competing with every other entry level organization out there. In my market, we're competing with the Walmarts and Home Depot and Lowe's and some of the big box stores for $15, $16 an hour. We were fortunate. We did a market analysis last year, and we were able to raise about 87% of our officers, base rate a little bit, but we struggle to recruit. We struggle to retain. We're seeing a pretty strong migration of people out of the public safety field in itself. With the civil unrest and some of the distrust that was created over the last year, that's not helping any of us recruit people to this profession. Where before, and there was great marketing strategies by some that say, if you're looking for a career in law enforcement or public safety, the best way to do that is start in healthcare security. You get the customer service, you get that experience. And I think that's still a great marketing strategy, but it's just not working the way it was before. I think the wages have a lot to do with it. I think the COVID has a lot to do with it. And I also think just kind of, at least in the US, some of the attitudes towards public safety are really keeping people away from considering this as a profession.
Thank you, Paul. So maybe just on a positive note, like how are you working effectively with your frontline and the other departments that you have to interact with daily within a healthcare facility? How is that? Healthcare is such a challenging environment in the best of times, and now it's just beyond. But what are the positives that you're finding in terms of collaboration and communication inside your facilities? Haji, do you want to go first on that one?
Sure. We already have had a good relation and good way to communicate with the other departments, and then so it didn't change much on as far as the lateral collaboration, because we did that already anyways. But the one thing that changed is the increase our communication and our involvement with upper executives. Because during this time, and I want to refer back to the protests and the threats. And again, also I'm just touching this really quick because it can be a whole presentation just about vaccine response and preparedness. So, but just because of that, I had to have continuous, constant communication with upper executives, especially those that were at the forefront of the media, to collaborate with them and put some mitigations in place. That was something that didn't happen before, because they didn't have that much exposure compared to now. So.
Thanks, Haji. Faiz?
Yeah, I'll actually echo Haji here. We had a very good relationship with the organization overall. We have an internal team. They've been here for a very long time, so they're seasoned and they have good relationships with majority of the departments here. When it came down to the frontline staff, the one thing I've always learned is that you have to recognize their hard work, especially with pandemic fatigue going on. You have to not just recognize their hard work, but you have to celebrate their accomplishments with them. So what we started doing is anytime we would end up getting a People's Choice Award from an organization, or somebody would be recognized for their hard work, we had lunch parties thrown in their honor. We made sure they were posted in our office, laminated, of course, because you want to make sure IPAC procedures and everything. But that includes the contract security guards. So, and we have an internal program. We have Paladin providing contracts. So even if they were recognized for anything, we celebrated those because they're a reflection of our team. So in return, they ended up coming back more, and they felt like they were valued. So we kind of also helped out with our labor shortage. But that's how we've been developing our relationships with the entire team. It worked out pretty well so far.
Thank you, Faiz. Martin.
Well, again, like the others, my department has a pretty good reputation within the organization. And just kind of like during my experience with SARS, security during COVID became the department of everything. And it's if they didn't know who to look at, they looked at security, and security can do it. And sure, we'll do it. We'll find a way to do it. And there were very few things that I was asked to do that I declined to do. Because as Paul Sarnice will often say, never miss an opportunity to take advantage of a crisis. So we did really well. But the other thing in respect to other departments is I believe that my role should be visible. I shouldn't be hiding in my office all day. I need to be out and about so that frontline staff in every department see you and see me and see that we're on the front lines with them as well. We're not just hiding in our offices. We're out and about. And the senior leadership at Baycrest has been very visible as much as they can be. With social distancing and all that, but being out, being there, being supportive is really good because it shows that you are living the life that they're living as well, and that you offer the support.
Thanks, Martin. Let's go Paul and then Jeff on this question.
Yeah, I think our relationship with our security leadership and our frontline officers hasn't been stronger because of our visibility and the rounding and checking on them and doing welfare checks and making sure they're okay and getting rest and recognizing them. I mean, that, as we all know, we all want to be recognized for a job well done. So I think that relationship is stronger than it's ever been. During the height of COVID, we had a daily call. We called it our State of the House call, and we had 68 different departments represented on there. And we're pre-hospital, hospital, post-acute, long-term care, pretty eclectic organization. And we never worked as well together as we did then because we had that interdependency on each other. And I see us kind of slipping back into our old ways today. And every chance I get in my organization, I remind everybody about the speed of execution we had during COVID. We had decisions in 24 hours and we got things done. Now I see that, and I'm sure many of us are kind of going back to that pre-COVID normal of it takes 10 meetings to get things done and so forth. And the communication might not be as open and honest and transparent as it may have been during COVID. So I think COVID forced us to lean on each other and depend upon each other, communicate and so forth. And I think it's our responsibility as leaders, if we see it slipping back to the pre-COVID ways of getting things done, to remind people just how we worked so well together and got things done in a short period of time to take care of our staff and to take care of our patients. And but it's a strong relationship. But I'm always afraid it's going to slip back into the pre-COVID kind of siloed world that we may have lived in before.
Yeah, that's true. It's like you're just fighting that human nature. Jeff, go ahead.
Yeah, not too much to add than what my colleagues have said. I think a key that really resonated with me is to recognize and celebrate, our frontline staff. And I think for the most part, we've all done a decent job on that. But I think when it starts to come from, the healthcare organization's leadership and clinical leaders in particular, I think whether right or wrong, it might have a little bit more meaning to our frontline healthcare security staff because it's coming from the organization and the clinical leaders, which may or may not have occurred too much in the past. So I think when that group starts to embrace and recognize and celebrate our frontline healthcare workers, healthcare security officers, it really goes a long way. So I think that's something that really resonates with me.
Great, good point, Jeff. Just want to remind our attendees, we're going to chat here for another 10 minutes or so. So if you have a question, you can record it now and we'll save them all for the end. But I have a couple more questions for these gentlemen. Okay, any tips for stress management? Another topic that comes up time and time again. I'm going to focus on healthcare security, but the pandemic has obviously lasted a lot longer than probably most of us thought it would in the first place. And as I think Paul said, is there any end in sight? Like, a new variant and who knows what's next around the corner for us. But so, how are you all managing this? How are you helping your staff get through this? Any tips you can share for each other and everybody on the call today? Haji.
So I'm going to echo back to what my colleague just said, especially the stress management. We manage that through increased management presence on every huddle, talk about it, and stay in contact with officers, because there was fear at the time. There was fear. You can see the fear in the security officers' eyes, not only because they had to ask to do everything, but also during the COVID, I recall officers were fearful going into a COVID room, because guess what? Just because it's COVID don't mean that we don't have disturbance in patients' rooms that have COVID. So we have to deal with that. Well, officers have to deal with, right, if I go to a patient room, will I catch COVID? All that. So education, we have to do some educations to deal with that fear in order to decrease that stress level. But increasing management presence, one of the colleagues mentioned, celebration, talking through it, and just encourage the utilization of tools available that our organizations have available for all staff members, great tools, just specifically for stress management. So we have to bring them those tools and encourage them to check them. Also encourage them to come to the doors. Let's talk about it. Time off. We had to encourage that. Also time out. If it's too much, step out. We will allow that to happen. Gather yourself back and go through. So all those together, that's how we have to deal with stress management.
Thanks, Haji. Paul?
Yeah, I think we need to provide every and all tool available to our staff. I mean, we all know that alcoholism went up, depression went up, suicide went up. And I'm not a doom and gloom guy, so I'm not. But this is just the reality of what happened with COVID and stress. The best way to get to relieve stress is to get away from the stressor, right? So if the work is creating stress, we had to make sure that our employees were getting the ample time off from work. And that was not so easy during the first surge. So we need to give them time away from work to decompress, to distract themselves away from whatever it is. We got to the point where we were downloading apps on our phones for mindful meditation and 5-minute breaks. And we brought in our employee assistance program to do counseling sessions about how to recognize stress and it was basically a chart, and it was almost like a pain scale where you saw smiling faces or sad faces, and you had to identify on that chart were you coping, were you managing, were you in crisis, and it was red, green, or yellow. And if we identified, certainly if somebody kind of self-disclosed that they were in that red area, we got them all the help that they needed. And the first thing we do is took them off the schedule, and we gave them time away from work. But I think we're all feeling it, and we may not practice what we preach to others as well. So I think taking care of our well-being is first and foremost too, because we can't take care of our troops and our others if we're not taking care of ourselves.
Right. Thank you, Paul. Jeff.
Actually, when the question came up, I scribbled down some notes, and then Paul basically said everything I was going to say. Is that the fatigue part of the stress we have to recognize. When this first started, we were all okay, 7-day a week, 12-hour days or more, and we got to get through this for this month. 1 month turned into two turned into 6, and now we're at coming up to 2 years. We have to give our folks, including ourselves, that break and that downtime away, as Paul said, get away from the stress. And even I think the Premier of Ontario recently recognized that by his new policy that he's rolling out about getting away and unplugging from the work. And we need to ensure our folks have that time away from work. And on Paul's note, we need to make sure we also, because we might not do what we preach as well. So get out there and live healthy, get some exercise, and don't drink too much, right? So we need to take that advice ourselves.
Thank you, Jeff. Martin?
Yeah, same as what Jeff was saying. At the beginning stages of whatever year it was that this all started, it was 2020. Yeah. So as Faiz alluded to earlier, I started in security when Noah was building the Ark. So I'm used to going through this. I've gone through stuff like this, and I know what my limits are. But when the first few months of COVID hitting, my coordinator, Aaron Sahin, and we both worked 14, 15, 16 hours a day for about 6 weeks at the beginning. And people were coming to us and saying, you're here all the time. You've got to look after yourself. And my boss was one of them. And I said, I've been doing this long enough that I know what I can do, and I know when I need to turn off and decompress, because, we all have mental health. We may not have mental illnesses, but we have mental health, and we have to look after our mental health. And we have to ensure that our employees are looking after their mental health and giving them the opportunity to go hide in a corner and cry, or go scream into a pillow or something like that. Because if they don't release it, if we don't give them an opportunity to release it, it's going to blow up in their faces right at work. And then that's going to be a really bad situation. So making sure that our employees get the recognition, get the opportunity to take off time, to go and decompress, to walk away from their post, not walk away, but ask permission to walk away from their post and just go have a cigarette in the parking lot or something, allowing them to decompress and recognizing that their mental health is important. And we need to look after that and ensure that, if we don't look after their mental health, their physical health is going to suffer, and we're going to suffer as a result.
Thanks, Martin. Maybe Faiz, before we move on to the last or the next topic anyway, just thoughts on stress management.
I will echo everything everyone's been saying. The Mindful app, by the way, is a lifesaver. I will be a strong proponent for it. But yes, we had a lot of wellness initiatives that the hospital was doing. We made sure that you are a leader, so you lead. So if there was an initiative for meditation that they were asking employees to sign up for, you sign up. You take a few guards with yourself to go and take 15 minutes off, just de-stress, and you don't have to be connected to the phone. That's the other thing as well, like with social media and everything, because you're getting news so quickly these days, right? So you have to learn to just disconnect when it comes onto your device. But other than that, vacation time, anything they needed, we always ensured that they were approved. But from the manager's perspective as well, we have a very good management team, and the way they worked out was, if in case you are working, because everyone worked 7 days, everyone worked long hours, but then you had a little bit of time off for yourself, where somebody else will take over and ensure that your department is running the way it needs to, right? So this way around, you don't end up burning out yourself. So institutionally, we had a very good response, and also like with Black and McDonald, sending out flyers, sending out just notices, advising everyone that mental health is a very, very strong proponent when it comes down to the pandemic. And we don't feel it, but it ends up happening. 2 years, you definitely end up feeling it. The pandemic fatigue is very real. So.
Thanks, Faiz. I have one more question for you folks, but before that, there's a question in the Q&A, and I'm just going to throw this out to the panel, but can anyone touch on the compensation, if it will or should change for healthcare security frontline officers? Who wants to tackle that one?
I'll grab that. So one of the things that happened early on in the pandemic was that the provincial government increased everybody's pay. Frontline healthcare workers got a $4 an hour increase, I believe. I worked with my provider, Paladin, because of the difficulty we were having in getting some people. I said, pay them extra. But yeah, it's always bothered me. The one thing that I've always hated about the security industry is that we have the greatest responsibility of almost anybody in the organization, and we're usually in the lowest tier of pay. And it's unfair, because you get really good people that are keen and eager, and then they realize the inequity in the position. And it's like they're busting their butts out there for, not a whole heck of a lot of money, and then they see other people that are making way more money than they are, and they're not equally compensated. So they're making more money, but they're not working as hard. So Yeah, we really do need to work on the security wage scale across the board. If we want qualified people that are going to look after our properties, whether it's an apartment building or whether it's a hospital, we really do need to work on that. And I've tried over my career to get the security guards to get more money, because if we get them more money, they stay longer and they feel the appreciation, and it's an important job. We're walking around with the keys to the castle, and it's really important. So I'm fully an advocate of getting the security guards the wage they deserve.
Thank you, Martin. Does anybody else want to comment before we move on?
The market analysis I mentioned earlier, we did, and we ended up giving about 87% of our staff a rate. The rate increase was because of a shopping experience in Walmart I had. I was checking out of Walmart, and it said $16 an hour to start for a bagger. And our officers had a minimum starting wage of $15.15. We need to look at the market, because we are competing with everybody else that's out there, and we ask more for our employees than a bagger at Walmart or somebody who's stocking a shelf, but making more money than we are. I think we just got to continue to sell the value that we bring, and then look at the market and bring our officers up. Just like, if we're going to attract good officers, we have to be able to pay them to retain them.
I do too. I believe same thing Paul mentioned in Martin as well. As security professionals, especially organizations such as IHSS and the organization that actually focus on healthcare security, it would be great to find a way where we can document best practice and best pay. And by that, I mean, if I'm making an argument for my off-duty police officers to have an increase, I go to their local. I forgot what they call them. They have actually a recommendation as to off-duty police officers should be paid this much. Now, when you present that document, it's going to be hard to debate, right? So I think we should really work on that and see how we can provide that to each market, so that whether it's through the local IHSS or whichever organization that would back up the need of or the argumentation of raising wages for officers, because they do a lot, not more than most in security industries.
Okay.
Yeah, I think so too. I think we've all got sort of a role to play to educate, and beat the drum for our folks within our organizations. I think on the contract side, we also have a role to play to educate, the procurement folks that are overseeing the RFPs and the process, that they're usually purchasing widgets and not services, not people, and we need to ensure that they understand the pay rates, and it's not necessarily a low bid situation every time. So we have a role to play there to educate those folks and make it a value evaluation, not a low bid evaluation for those contracted RFPs.
Thank you, Jeff. Okay, we're coming to the end, so maybe we should try and wrap it up. So I wrote this question before things got a bit more complicated in the last week or so, but what are your expectations for 2022? Are we headed into an adjusted new normal that we'll see for the foreseeable future? We're coming to the end of this year, and as we discussed earlier, I don't know if anybody foresaw this stretching into 2 or 3 or beyond years, but what are your expectations for the year to come and going forward? Faiz, what do you think?
I think so. I think this is going to be the adjusted new normals for a little bit more longer, especially with Omicron right now. So I just hope that with the high vaccination rates and just vaccine passports and so forth, and any of the band-aids that are being introduced, that we don't end up going into a new lockdown after coming out what seemed like one of the longest lockdowns in history. So I just hope that at the end of the day, with the vaccine rollouts and everything, that this is something that's going to be a little bit more easy. You're going to deal with it for the next 2 or 3 years, but at least at the end of the day, you have some sort of normalcy back, right? Whether it is going on a trip or whether it's going to the theater to watch a movie, but at least you have some sort of normalcy back. But we're in this for a while.
Thanks, Faiz. Paul?
Yeah, I mean, we are in this for a little bit, and I use this with my staff a lot. I refer back to World War I, which I think was 4 years, and World War II was 7 years, and that was, it impacted the world just like COVID is right now. And people came together and they did the right thing, and they stepped up and they got the job done. And we're going to do the same thing. This is, I don't want to compare this to war, but we are fighting a virus. And we just have to have the mental fortitude to know that this is the way it's going to be. There will be light at the end of the tunnel. We will get back to the pre-COVID norm. It may be a little bit different, but this is not going to be like, it won't be like this forever. And we just have to have that mindset. We're going to get through it one day at a time. There's going to be light at the end of the tunnel. We're going to learn from all of our lessons over the last couple of years. We're going to get better, we're more efficient, and we're going to get through this.
Thanks, Paul. Jeff?
Yeah, I echo. We're in this for a while. What a while is undetermined. I think our best approach is maybe take it, maybe not day at a time, but not look too far out, because things will change, things can change. I think that, as my colleagues have alluded to, we're in this for a while, so we continue on and just be resilient. And, we talked about mental health. I think that's a positive that's come out of this is people are more openly talking about their own mental health and other people's mental health, and the stigma, is starting to go away about that. So that's, I guess, a good thing if we're trying to find good things that come out of this. So that would be my message.
Thanks, Jeff. Haji?
Thanks. I agree. This is going to be the new normal for the next few years. For as far as healthcare professionals, we wish that we can continue the lockdown. It works for security. We have better control of our visitation. But unfortunately, I think within the next year or so, our hospitals will start opening up a little bit more than normal. However, when it comes to the anti-vax sentiments and the threats to receive, I do think it's going to continue, as well as the psychological effect of long-term COVID. I do think we're going to see increase in that as well. So that's just an opinion now, not fact.
Thank you, Haji. Martin, I'll give you the last word.
Well, it's going to carry on for a while, but for me, it's going to be over in about 18 months when I retire. So one way or another, it'll be over for me. And I can't remember who it was that alluded to it earlier when we were talking about vaccinations, is we got to vaccinate the world. And we've got to get the vaccines to Africa and to the third world countries, and we have to get the rest of the world to get vaccinated, because this new variant is coming from a part of the world that isn't vaccinated. And until we can get the rest of the world vaccinated, 4% of the population of Kenya has been vaccinated. That's appalling. And we as first world countries need to support our third world countries. Otherwise, this thing is going to live forever.
Thank you, Martin. Okay, I think that's going to wrap it up for today. So, of course, I want to thank our panelists. I want to thank Martin, Haji, Paul, Jeff, and Faiz for joining us and spending some time with us today. Again, I think this is going to be the end of the conference for today. So I want to thank everybody for joining us, all the speakers and panelists for participating, our sponsors, Assa Abloy, Access Communications, Garda World, Johnson Controls, Metallic, and Convergent Technologies, and of course, our industry partner, the International Association for Healthcare, Security, and Safety.